This is One on One. Welcome, this is Steve Adubato. We're actually on location at the Healthcare Foundation of New Jersey. This is part of a series we're doing called Breaking the Cycle. Cycle of abuse, cycle of bullying, particularly among teens. We're pleased to be joined in this conversation by Brian McGovern, CEO, North Jersey Community Research Initiative. Good to see you, Brian.
Thank you.
It's interesting, the population you serve, describe it.
Well, we serve a very variety of people at NJCRI. We have both a medical side and a social service side. The people that we serve are our newer community, which one population happens to be an LGBTQ center. We also have a medical center where we also serve them. We also have mental health, substance use, case managers that help the homeless in that population, food pantry. So quite a variety of services.
But when we talk about abuse, you said to me before we got on the air, you know, we would be a lot better off if we were more tolerant. Why is it so difficult for so many to be tolerant, particularly of the LGBTQ plus community, if you will?
I think that people are not comfortable with what's not them, or they're not exposed to it.
What about if they have a family member, a friend, someone they're close to?
Exactly.
Shouldn't that do it?
Well,
because they know what that person's experiencing?
Well, we hope. And I think sometimes that's what brings us there, is that if we've experienced something close to us and someone we care about. But there's religion that gets in the way. Many of the young people we serve are from strong religious backgrounds, so their family are having a hard time with it. To speak to an LGBT person, me being one, you see people that might go through their own personal struggles of accepting their own identity as an LGBT person. What was good for me to do was able to understand, if I'm struggling with this as a young person, what are the people around me that can't even understand what I'm going through? So I had to have my own tolerance with people to have them understand. So I think that's something. I think we're in a different world today.
How so?
I think with the social media, with so much more education online where our young people can get at, where I think years back people were more isolated. 10 years back, it was a different world. So I think today we hear more about gender identity. We hear about bullying in school. We hear about bullying on the streets. In Newark, we have a youth drop-in center for LGBT. We've seen it in our youth drop-in center, which is in the Central Ward.
You're seeing it every day?
Yes. Sadly, we had a young person who had a gun. He was 16 years old, asked the person, "Are you gay?" and then shot him.
That's what happened?
That clearly. That person, sadly, the 16-year-old who identified as straight, ends up going to jail for that. The young man who was shot did survive and did recover, but it's a tragedy on both sides of that.
Are we outraged enough, Brian, when we hear of a situation like that? Are we outraged enough about the bullying and abuse that young people, particularly those in the LGBTQ community, face? Are we outraged enough?
You know, it's hard to say. I think it's hard to be sometimes because there's still fear there, especially in an inner city where maybe it's not as tolerable, LGBT or just in general, other things being different. So we have seen gangs go after our LGBT at times, so we have to be careful. So I think it's almost hard that we can't be. I think what we have to be is more forceful in education. We have to be forceful in exposure and giving positive experiences, and less being angry, but maybe trying to help understand and get people to understand who we are.
Brian, I'm curious about something. You said you identify with the community we're talking about.
Yeah.
Beyond the policy issues, beyond the public television discussion we're having, the forum we're having at the Healthcare Foundation today, describe for folks what you experienced, particularly as a teenager.
For me, what happened with me was I was a jock. I was, very athletic. I was on swim team, run team, track and all this. So what I found was for the effeminate guy, I felt like it was easier for him.
Because?
Because I was this guy that they just saw as the macho straight guy, or whatever you want to call back then. So to be out, I wasn't really out. I was on all these teams and everything. I didn't come out till college.
Did you want to,
I didn't.
If you could have a mulligan, I'll use a golf reference, would you have rather have come out in high school?
You know, I also enjoyed the sports, and I don't think the sports were ready for it at the time.
They're mutually exclusive, coming out and being an athlete competitively
I think
in high school?
back when I was younger, yes, and I think today it's changed a little bit. But
How much?
I think it's still a challenge, though, for many of our young people in the sense of mixing those and mixing the different cultures together. You know, we think of your own high school when you were back, the different cliques that were there.
All boys Catholic high school in Newark, New Jersey, SS Catholic High School. I often think about that.
Yeah.
And there were some young men
And I knew not one other gay person in high school, as a high school person.
You did not.
No one was out.
No one was out.
Yes.
For us, the young men who came out significantly later.
Yeah.
You know, after the mid '70s when I was there, and I often wonder how would we have been?
Yeah. But I have to say, what I admire is the young people that can come out. And I think the ones that are brave enough to come out in that. I enjoyed my sports, but maybe I also hid behind it a little bit. So I have to see that. So I admire people that can come out with that. And I think what today, for example, our youth center, it's about 20 years old now. That's something I didn't have, a lot of people didn't have. A lot of people didn't have that, or maybe still don't have
resources.
That in smaller. Yeah, the resources.
By the way, throughout this interview, your website will be up. And by the way, if someone goes to that website, what kind of help would be there for them, Brian?
A large majority of stuff. When I talk about the youth center, I'm going to focus. We do so much, so please check out the
Focus on the youth
website.
center.
But the youth center is LGBT youth center after school till about 8 o'clock at night and weekends. So we try to point out that time. We do everything from sexual health, substance abuse prevention, sexual prevention, safe
Sexual
place.
disease prevention.
Yes, I'm sorry,
Right.
HIV or such like that. PrEP is a new medication now for that. So for the older people, the older young adults, we also it's very much about empowering. We actually use a program called Empowerment Program. It's a curriculum to work with the kids for their self-esteem. It is all about that. They are the leaders of the drop-in center. They run the drop-in center. They do events, community events. So they're going in the community, normalizing LGBT and bringing it out there for people to see. They're doing events multiple times a week. They do dances multiple times a week.
And to that end, by the way, Brian's going to be part of a 10-person, 8 to 10 people will be part of this panel discussion. Last question.
Yes.
That panel discussion is on breaking the cycle of abuse, of bullying, particularly amongst teens. We succeed in that panel discussion if we achieve X. What's X?
I think I go back to respect and tolerance of each other, no matter what your, I might be talking today about LGBT, maybe some of your other people will be talking about other subjects.
There will be.
It's all about respect. Respect everybody for who they are.
Brian, I want to thank you for joining us. We appreciate it.
Thank you.
I look forward to the conversation.
All right, thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, the New Jersey Education Association, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, Office of the Attorney General, Wells Fargo, and by Georgian Court University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.